To help educate cancer patients and improve patient and provider conversations, the CDC Foundation has launched a first-of-its-kind virtual simulation tool named Tina. Here with more about the application are Dr. Lisa Richardson of the CDC and physician Bob Lupitz. Welcome, you two.
Good morning.
Good morning.
Thank you.
Happy to have you here. Dr. Richardson, I want to start with you. What is the Preventing Infections in Cancer Patients program all about?
Well, it's a overall program that includes information for patients and education about infections during the time that they're getting chemotherapy. How to reduce the risk. When you get chemotherapy, you have a risk of getting a low white blood cell count, which is also called neutropenia. And the program really teaches patients about how to stay healthy during that time.
And you've got this new program now, the simulation tool called Tina. What exactly is Talk to Tina?
Well, Talk to Tina is a virtual avatar experience. Tina is an avatar. She's a healthcare provider, and she teaches healthcare providers and patients about a low white blood cell count, how it happens, when it happens, and what they can do to stay safe during that time.
And how easy is it to use Tina?
It's very easy. She is available on the web as well as apps that you can download to your Android or Apple phones. And it's an experience. You just click on start and you can start working through the avatar and the information immediately. Really
amazing how tech is being used now and in our everyday lives, especially when we're encountering something that's so, serious. Dr. Lupitz,
Absolutely.
Can you tell us about your experience with cancer and with treatment?
Well, anyone who's told they have a diagnosis of cancer, it's just such a devastating, overwhelming, disoriented feeling. And I was really fortunate to be surrounded by family and friends and have a great medical team. My treatment most recently was chemotherapy. I had it this summer and had 6 courses. And I had a lot of the common side effects that people with chemo have. So I lost my hair, I was fatigued, and I lost weight. And I also had this neutropenia, this low white blood cell count.
And how are you doing today?
I'm doing great, thanks. I was very fortunate, had great medical care, and my family took real good care of me during the course of treatment. And I kept a really healthy, balanced diet, and I exercised regularly and did a lot to prevent infection. And as a result, I've done well.
We're glad to hear that here. I'm wondering, how do you think that a resource like Tina might have helped you during your treatment when you were going through this?
Oh, Tina would have been an incredible resource when I was getting treatment. I think the challenge is that there's just so much material out on the web. And also, when you're meeting with your doctor, sometimes you forget to ask questions, or you forget exactly how they explain things. So having a website like preventcancerinfections.org and this interactive avatar, Tina, would have been a great help for me to remember things, ask new questions, and gain new information.
All right. And to get that information, we can go to what website again? Can you repeat that?
It's preventcancerinfections.org.
All right. Thank you both for being with us today. We really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.